Omicron. Why is it different? By the end of this video, you will understand what we know about Omicron so far and why Omicron is so very different from Delta. We will look at its structure and how that helps it evade your immune system and what to expect for symptoms. You will also know what we don't know and need to find out. Omicron is causing the fourth wave of COVID spikes in the world. Although this graph represents South Africa, it is a good approximation for the expected pattern in all countries of the world. The first wave is the original Wuhan strain. The second is the Beta strain, also identified in South Africa. Then Delta, which has been dominant for the last 2 years. And finally, Omicron, the newest worrisome variant. The reason we think this fourth wave is occurring is because the Omicron is built very differently. It has between 45 and 52 mutations or changes in its genetic makeup. More than 30 of these are in the building blocks making up its protein spikes, those spiky projections surrounding the outer envelope of the virus that are very important for determining how well the virus can evade cells in your body. These genetic and structural changes are thought to allow the new Omicron virus to partially evade the immune system. Because your infection-fighting cells, the T cells, or the antibodies that are in your blood don't recognize the virus as an invader, as well as they did the previous variants. Because of this, so far, Omicron appears to be 2.5 to 3 times more transmissible than Delta. A single Omicron-infected individual can spread the virus up to as many as 8 other people. With Delta, this number was closer to 2. This holds true when we look at household transmission, how often the virus spreads to people living in the same household. This ability to evade the immune system is also demonstrated when we look at the effectiveness of vaccines to prevent infection. With the Delta variant, the Pfizer vaccine provides approximately 60% protection from infection with 2 shots and 95% protection from infection with a booster. With Omicron, the standard 2-shot gives 33% protection and the booster provides 75% protection. Moderna appears to be similar, and Johnson & Johnson is much, much poorer. A very striking finding is that prior infection with COVID does not provide protection from Omicron. Likely because it is so different from the previous variants, your body has difficulty recognizing it as the same virus. However, with a history of COVID infection and vaccination, some infectious disease experts have stated you can be super immune. The bottom line for everyone is get vaccinated, get boosted, and get an mRNA vaccine. Although the infections are going up dramatically with Omicron, the rate of hospitalization and the deaths for adults so far have not. Right now, we don't know if this is because Omicron causes milder disease or that so many of the people infected are younger adults and many either have had COVID previously or were vaccinated. The one very worrisome trend is a 20% increase in hospitalization rate for children. That is an area we must investigate further. What we do know is that the symptoms of Omicron are very different. Originally, high fever, cough, shortness of breath were predominant symptoms, and often with loss of taste and smell. With Omicron, the loss of taste and smell is very uncommon, and in South Africa and in the UK so far, the predominant symptoms are a runny nose, headache, fatigue, and sneezing. Tim Spector, a British epidemiologist, states the predominant feature of Omicron is that of the common cold. However, we have to be very cautious because we don't know what the real change in death rates and hospitalization will be, in particular for those most vulnerable patient populations, the unvaccinated, the elderly, and the immunosuppressed. This is a rapidly evolving landscape, and the data will be forthcoming. In the meantime, we all have to do the best we can to protect ourselves and our loved ones. For more interesting COVID information, try this additional video and click subscribe.